Alliance for Health Equity. I know, I'm sure we have some new people today, so just giving a little intro there. So to start our meeting, if you don't mind share, oh, she, her pronouns for me. If you don't mind sharing either in the chat or out loud, your name, pronouns, organization. And our ice warmer today is how do you celebrate the youth in your life? Because today is International Youth Day. So for me, I don't have any kids that are youth, but I do have, I'm in a mentorship program and my mentee is 14, getting ready to go to high school. So I really enjoy supporting her and encouraging her and helping her get ready for the next step. So if anyone else wants to come off mute and share or share in the chat, we'll give a moment for that.
Hello, everyone. My name is Chris Chambliss. I am with the Executive Director of the Nehemiah Community Project. Identify as he, him. And how I celebrate youth that are in my life, I celebrate it with humor. As we matriculate through this thing we call life, when I work with the youth in my community, I use humor to really bring more of a calmness to the environment, help us navigate our next step.
Great, that's awesome. Thanks for sharing that.
Well, since Chris referenced Prince, I feel like I have to celebrate that and go. I'm Jennifer Brothers. I use she, her pronouns. I'm with Cook County Health Office of Behavioral Health. And I celebrate the youth, which happen to be my children, by just loving them in the hard, in the good, celebrating the highs, holding their hands and giving hugs and just being with them and sharing space and listening and in the hard and the ups and the downs. But just really celebrating their individuality and their authenticity and celebrating their vulnerability.
Great, thank you for sharing that. And in the chat, we're seeing chasing around a 3-year-old. That's definitely celebrating and playing, supporting special moments like a quinceanera, asking about their day, giving them space, all of those wonderful things. So we're going to keep going for the sake of time, but please continue to share in the chat if you would like. Our agenda for today, we're going to talk about some updates. We're going to then focus most of our time on the very soon upcoming event, the Systems in Sync event. We'll have several updates on that. Then we're going to talk about some ways that your organizations can present at the event. And then we'll have a couple of discussion topics, including the connection sessions, which are the heart of the event, and also what is the next step? How do we continue the momentum around relationship building and partnership after this event? And then we'll review some next steps and wrap up our meeting. Just a reminder of our community agreements for the group. Be creative, listen with an open mind, assume good intent, and all these other wonderful guiding principles we have. Okay, now to some updates. Just one quick update from the IPHI team. A few of our Alliance for Health Equity folks submitted a proposal for a grant from the WT Grant Foundation last week. The grant proposal is based around developing a toolkit to measure social connectedness among youth, specifically with youth of color in disinvested neighborhoods as the target demographic. So we are hoping that that money gets approved so we can put that toolkit together, because we have noticed in our research that there are some tools to measure social isolation and social connectedness, but they're mostly geared towards adults, particularly older adults. And what we heard through our CHNA process is that youth are really having a hard time with social isolation. It's a growing issue among youth. And so we're trying to get that resource built, but it'll depend on the funding. We'll find out, I think, in October. So fingers crossed for that. So any of our partners, if you'd like to come off mute and share any updates you have, I'll give you a moment for that. Okay, I'm gonna take that as a no updates at the moment. If something comes to mind you want to share, please drop that in the chat. Okay, our big topic this month is our Systems in Sync event, partnering for equitable mental wellness. Just a review, it's an event to bring together community organizations, healthcare, health departments, and people with lived experience collaborate, connect, and share best practices to improve mental wellness and reduce inequities in Cook County, and that is both Chicago and suburban Cook County. Some basic facts and updates. The event is going to be Thursday, September 18th, so that's coming up fast. Will be from 9 to 4 p.m. It will be held at the Bulgar Park Community Center in Melrose Park, which is a really great venue. We're happy to have secured that. And then I have the registration link there. So I think Isabella is going to drop that in the chat for us. Please make sure to register if you'd like to attend. And each person in your group needs to register individually. It is free registration while providing lunch and some other refreshments. And if you are presenting or participating in some way like that, you still need to register just so we have that total head count. Yes, and Isabella also dropped our partner support sign up, which we'll get to in just a second. So registration is open until September 1st at 5 p.m. That way we can get some final counts to our caterer and plan for everything. As I mentioned, all attendees must register individually. We have confirmed 2 of our panelists for our panel that we're holding. One is IPHI's own Ed Stellan, who you may know from his extensive work in the mental health space, as well as working with unhoused folks and the Community Information Exchange Project. So Ed is a sort of broad expert in this area. And we've also confirmed a state rep, Lindsay LaPointe. She is a representative from the Northwest Chicago area, and she also co-sponsored a bill for mental health parity and Medicaid coverage and Medicare coverage. So definitely someone we are happy to have. We're in talks with a few other panelists, so hopefully we'll have more updates on that for you soon. But we're happy to have those 2 locked in. In addition, we are reaching out to community members with lived expertise of mental health or substance use to attend and give feedback on programs during the breakout sessions. We're looking at this as like almost a mini focus group for folks. So you can go talk with the community members, ask some questions if you have about your program, get some feedback from their experience. We have a few already that we're talking to, but we would love to get community members from, diverse geographic and demographic areas. So if you know someone from one of your programs or your advisory councils or whatever, then please let us know. You can email me. Community participants are giving compensation for their time and expertise, including if they need support with travel. We're still working out the exact amount, but it will be, they will receive compensation. And I do also have like an info sheet for our community members. So if you need more information, I can definitely give you that. Any questions before we go on to the next section? And yes, Jess, thank you for that comment in the chat. We are so grateful to our partners that have been involved in the planning. Our co-hosts, NAMI Metro Suburban, the Transforming Communities Initiative, which features Loyola Medicine in the Quinn Center, and the County Department of Public Health have all agreed to be our co-hosts, which is wonderful. If your organization still wants to get involved in putting on the event and see how to partner, we can definitely figure something out. Speaking of which, we have some partner support needs. Is your organization able to provide financial or in-kind support in any of these areas? Because these are things we still need taken care of. And so Isabella just shared the link in the chat. It's a short form to sign up to provide support in any of these areas, including printing. So things like handouts, registration packages, packets, signage throughout the event. We need event supplies like badges, folders, pens, tablecloths, all that miscellaneous stuff. We also need event staff, so folks to work the registration table to help with setup and cleanup, transitioning between portions, answering questions. We're also recording the panel and the program presentations for anyone who's not able to attend in person. So any resources for that, or for taking some photos of the event, because we want to make sure we have a record. Also, if anyone is able to offer translation help, particularly with Spanish, possibly also ASL, and the Spanish would be both translating like the event materials, the written stuff, and live translation at the event. So if you have a staff translator at your organization, or just one of you speaks Spanish and can help us out with that, that would be great. So you can sign up at that form linked in the chat and let us know what support you're able to give, if any. But even if you're not able to support us in any of these ways and you can attend, that is number one. Any questions before I move on?
Oh, Sam, hi, this is Lisa from Northwestern Medicine. Do you know approximately in terms of supplies and I guess quantities of items?
Yeah, we're expecting around 100 attendees. That's
Okay.
what we're planning for. So that if that gives you an idea, I can also speak with you, at a separate time with more detail, but roughly 100.
Thank you.
Okay, we're going to move on, but again, if you have any questions, you can either put them in the chat or reach out to the IPHI team separately. We're happy to discuss things via email or meet and have a live conversation. So a couple other ways you can participate beyond just attending the event. We have two options to present your programs. The first one is a full presentation. So you would present on a current or in development behavioral health related program or initiative, and then particularly highlight areas where you would like to partner with other organizations, because that's the whole point of this event. The presentation should be about 10 to 12 minutes long, including a slide deck, and I do need to put on there about a 5-slide limit, just so we keep people locked in that time period. This is really a intro to your program, not a deep dive, because we will have the breakout time, which we are calling communication sessions. And so you'll be available there to answer questions, connect with people, go into more detail as needed. So that's why the presentation only needs to be a quick intro. Part of the requirements is submitting a 1-paragraph program description to me by Friday, August 22nd. That way we can have that printed out for folks in their packets. And then submitting the actual presentation slides by September 12th. So we can put that all together and have it for you. Again, register all team members who will be attending, including presenters. And if you would like to sign up for either of these options, email me, let me know which option, what organization you're from, and who the contact person should be. Then our second option is being part of our poster display. You create a poster that will be displayed at the event that highlights your programs, and make sure you would have to have your contact info on the poster so that attendees can reach out to you with questions or for partnership. We will need someone to come to the event about 30 minutes early to set up your poster. If you're already attending, that's not a huge difference. And then you can choose to have someone by your poster during open periods, but it is not required. You can also just have the poster with your contact info. And again, make sure to register anyone who's attending. Any questions on our presentation options?
I do have a question. What day is the event again? I'm sorry.
Thursday, September 18th.
Okay, thank you.
Yep, Thursday, September 18th, 9 to 4. We will send a more detailed agenda to folks about a week or so before the event. If you're presenting or co-host that type of thing, we will get you that even a little earlier. But September 18th, 9 to 4. Okay. As I mentioned, we will have these connection sections. So actually, let me review the rough structure of the event real quick. Folks will come in, we'll have a nice welcome, and then we'll have those program presentations, about 10 or so of those, to give a brief intro to a bunch of different programs and opportunities for partnership. And then we'll have our panel with our speakers talking about collaboration in this space, particularly in the context of our current political environment, which I know is on everyone's minds. We'll do lunch, and then we will have our connection sessions. We will have several topic areas, and these are just draft topic areas. We'll talk about it in a second. We'll have several topic areas identified around the room so that folks who are interested in that area, who have programs in that area, looking to partner in that area, can go to that area and find the people that are, you know, best partners who are also in that space. There will be 4 30-minute segments. You do not have to change every segment. You can stay, if you're only interested in youth mental health, you can stay there all 4 segments. We just wanted to make sure people have the chance to go to multiple topic areas if, you know, their program crosses over, because I know most programs are not just in this one specific area. Attendee, as I mentioned, you don't have to move to different segments, and we will provide some question prompts and other materials, but it is strictly optional. We really encourage open conversation, whatever you need to start getting that information and building those partnerships. So this space is really going to be all about connection and relationship building and coming together. So one thing we're going to discuss today is these 6 topic areas. These are our draft areas based on the survey some of you did like back in May when we were first planning for the event, as well as who our program presenters are, and then just things based on things we've learned in the health needs assessment, things we've discussed with partners. So it's kind of a amalgamation of sources for these. So to go over them real quick, we have community-based services, and that covers community education, living rooms, peer support, crisis intervention, and many more. These are not limited. This is just to give you an idea. And then community partnerships, including faith-based partnerships, working with community leaders, community organizations. Then we have youth mental health, including school-based services, outreach and engagement to youth, and that does include young adults. We have population-specific programs, so programs specifically catering to immigrants, refugees, unhoused individuals, LGBTQIA+ individuals, the under and uninsured, and any other specific population. Policy and funding is our next section, so that includes working around the funding cuts, federal, state, and local policy, as well as issues with Medicare and Medicaid. We have reached out to several elected officials in the area. I mean, of course, we'll have Representative LaPointe on our panel, but as well as other local representatives to try and get them in on this conversation. And then the last portion we have is behavioral health workforce, and that includes training programs, financial assistance for training, current employee support and training, and anything else that falls in that area. So does anyone have any questions on these areas? Is there anything that you believe doesn't fit into one of these categories, but you really want to see highlighted? Or is there an area you want to see highlighted that does fit into one of these categories, but isn't already mentioned here? Or do you think these categories are great and support us moving forward? So feel free to come off mute or put messages in the chat. Let us know what you are thinking. I see categories are great in the chat. Thank you. Agree, categories are good, great. And also, your conversations don't have to be limited to these categories. It's more of just a tool to help people connect. But if you find someone you want to connect with around something outside of these, no one's going to stop you from discussing that. We're just trying to provide some tools to help with those connections.
One thought and sort of question for the group, Sam. I agree. I think these categories look great and appreciate everybody's help over the last few months to kind of distill these. For the population specific, I feel like it would be good to think about how we, I believe that within the panel and the presentations, likely, hopefully, a number of these populations will be uplifted and referenced, but I think just really being intentional about how we address specific populations across the different topics and I think it's good to have, a station that's specific to that, but also, I imagine that those populations will really be discussed across all of the other 5 areas as well.
Yeah, thanks for noting that, Jess. There is, I'm sure, going to be several of these topics that sort of cross over each other and connect. So thank you for raising that.
I just have one comment that's not topic specific, but like, I don't know. If this was brought up during the planning session, is more about geography. And if you think about services and partnerships, because we're such a wide geography of suburban Cook and even in the city, how to I don't know, maybe think about like if you're on the south side, because like yeah, versus north side or west side, et cetera, or if you're out in the suburban Cook area. So that's a thought.
Yeah, thank you for bringing that up. We are planning to highlight or make that clear in some ways. One idea we're mulling over is having flags for your badge. I'm sure you've seen those at other events. You just like stick them onto your badge that say kind of your service area, whether it's north side of Chicago, western suburbs, all of Cook County, all of Chicago. So that's one thing we're thinking about to make it kind of clear who is where. Another option is to have add on instead of just these categories, or maybe within these categories, some sort of geography specific designation. So we're definitely open to ideas on how to best support that sharing. So thank you for bringing that up.
I like both, both flags and then like maybe a topic agnostic, like all the above, and you just want to connect with people who are like or serve the same population geographically as you. So I think those are both good options.
Great. Okay. We're gonna go on to our next discussion point, but again, please feel free to reference back to this and ask any questions or reach out afterwards. So our next discussion area is going to be talking about where do we go from after this event. We're not looking to make any hard decisions, just get some feedback because we do want to take into account what comes out of the event before we make any solid plans. But right now it's a very broad field, so we want to kind of see what your thoughts are. So as far as next steps after the event, what support would you like in building these partnerships, in collaboration and opportunities to work together? How do we continue fostering this collaboration so it's not just a one and done, it's an ongoing effort? So I'll open it up for ideas from the group, and then I also have a couple ideas that the IPHI team has come up with that we can discuss. So feel free to share in the chat or come off mute. And oh yes, while we're thinking about this, keep in mind these topic areas. So if there's something specific that you would like to see along one of these lines or considering all of these areas, that's something we can discuss as well. Okay.
I do
Go
have
ahead.
a suggestion. Is there any way that like for all the people that attend, you could have like a list or like a spreadsheet of everybody that is a shareable document?
I think that's a great idea, sort of like a reference source to reach out to folks after the event. We can
Yes.
definitely do that. So a few of the ideas that the IPHI team has been tossing around include some learning sessions, which could be either around uh, topic wise, like best practices of a certain type, policy updates, funding updates. We can also do collaboration resources, um, skills and training around maintaining good partnerships and relationship and trust building. Another thing we've thought of is doing regular program updates. So every however often have a programmer to give an update to the group of, this is the program we discussed at the event. This is where we're at now. We've built this great partnership. We're now expanding this way. We can do some combination of multiple ideas. How does any of those or any additional ideas sound to folks? I like doing the policy updates and training session. We will also have an exit survey for the event, which will ask some of these same questions. So I know not every attendee is in this meeting right now. But just to get us on, on track to aligning with what folks actually like, so we can have some options prepared for soon after the event, instead of us having to take, 2-3 months, especially getting into the holiday season, to take that next step. We want to keep that momentum. So having feedback now will help us with that. Everybody quiet on this Tuesday morning. Okay, well, as usual, feel free to reach out to me afterwards if you come up with an idea, or there's something you like to see. I'll also, of course, be at the event and available to hear any inspiration we get while there, and we'll have that feedback survey as well. So leave this topic open for another minute or so in case anyone has any thoughts. Well, I think this sounds great, and I support collaboration, great minds. Yes, we are so excited for this event. We've had such enthusiasm from all across the behavioral health and beyond space, and really hope that this proves beneficial to a lot of folks, because many people have expressed a need for this type of connection. So before we wrap up then, I'm going to open the floor for any questions, comments, concerns about the Systems in Sync event as a whole. Remind you to register, since we're going to be ending this meeting a little early probably. If you haven't registered yet, click that link and go register. Yeah, so open the floor for anyone at this moment. Okay. Well, then we'll wrap up a little early today. A reminder that our September meeting is canceled. I believe I already sent out the cancellation, but a reminder, no September mental health work group meeting, because we are having our fabulous event, and I will hopefully see you all there. It's September 18th. Our next work group meeting then will be Tuesday, October 14th, from 10 to 11. If you would like to present or have a suggestion of a community member, have any other questions or thoughts around any of the things we discussed today or the event in general, please feel free to reach out. I'm going to drop my email in the chat, although I'm sure you've all gotten a million emails from me. And if you are able to provide some support for the event, you can also sign up at that link. Isabella, would you mind resharing those two links in the chat so they're at hand?
Oh, yeah.
Thank you. And then those of you who have already signed up to present, please get those descriptions to me by the 22nd, and share the registration link and the marketing materials we've sent out with folks in your networks that you think would benefit from coming to this event. If you need me to, we'll probably resend all the marketing materials with the follow-up email for this meeting. So if you don't have that, you'll be getting it soon. And thank you everyone for joining us today and on September 18th. We're really excited and to have you all, and yeah, have a great day.